My name is Dr. Johnny Downs. I'm a child and adolescent psychiatrist and clinical researcher at King's College London. I've received a Medical Research Council grant to use CRIS to examine the health and education outcomes in children with autism spectrum disorders, or ASD, who develop mental health problems. CRIS provides a very important resource that allows me to understand the experience of children with autism and mental health problems. For example, in a recent study I found that for children with autism who present to specialist mental health services, over 50% of them will have additional psychiatric diagnoses. I also found that children with these additional psychiatric disorders are much more likely to receive off-label pharmacological treatment in addition to psychological support. Until now, and without the ability to use a resource like CRIS, it has been difficult to understand the types of mental health problems that children with autism present with and how they are treated by specialist NHS services. Another very important aspect of CRIS is the link it provides with other anonymised datasets. For example, using secure confidential linkage processes, we've established a link with physical health data recorded by acute general hospitals. This enables us to look at the impact that mental health conditions and treatment may have on physical health problems for children with autism. For instance, there's been some suggestions that children who have autism and ADHD are much more likely to be hospitalised with epilepsy. I was able to see if this occurred in a much larger representative sample using CRIS-linked health data. I found that children with both conditions are no more likely to have epilepsy than children with autism alone, which suggests that having ADHD and receiving ADHD medication treatments do not increase the risk of later epilepsy. And finally, and a key aspect of my research with children with autism, is the CRIS linkage to education data. I'm conducting studies that examine what mental health and school factors are associated with lower than expected academic attainment, absenteeism and exclusion. These findings will then be used to better understand which aspects of mental health care benefit children with autism in their time at school.